Discovery Health has strongly disagreed with the findings of the final Section 59 investigation report released by the Health Minister. The Section 59 investigation relates to allegations of racial profiling of black healthcare providers and medical scheme fraud, waste as well as abuse. For more on this, I'm joined by Dr. Whelan. He's CEO of Discovery Health, which is among the health schemes that we actually mentioned yesterday. Good afternoon, Doctor. Thank you very much for joining us on the program. So that much-awaited report, starting in 2019, has been released and has found evidence of systemic bias in fraud, waste and abuse investigations with black practitioners disproportionately targeted. Now, you have since issued a statement strongly disagreeing with this. Take us through your views.
Well, firstly, thank you for hosting us. This is a very important and serious topic, and it's important that we have a fully fledged discussion and debate on this. I think I wanted to start out by just highlighting that fraud, waste and abuse, as well as errors in the healthcare system, is a significant issue. In fact, it costs the industry somewhere around 30 billion rand per annum. That's roughly 11% of private healthcare claims in South Africa. So it's a significant quantum. And effectively what it means is it's payments for services that weren't rendered by healthcare practitioners. Discovery Health in itself recovers somewhere in the order of 500 million rand across the schemes it administers on an annual basis. And were it not for those recoveries, medical scheme contributions would be about 11% higher. So a significant issue across the system. The second point I wanted to highlight as a starting point on this is that it affects a very small number of practitioners across the system. So across Discovery Health, we've had just over 3,600 valid findings. That's across a healthcare professional base of about 50,000. So it impacts somewhere around 7% of your healthcare practitioners across the system, relatively small. And out of those 3,000 findings, or 7% of the findings, a very, very small proportion of those go on to a significant finding, pointing to potential actual fraud. Many of the findings point to errors, to some extent wastage across the system. Only about 0.2% point to actual fraud across the system. So a big problem across the system, but isolated to a small number of practitioners. Mm-hmm. In relation to the Section 59 report, I think, as you mentioned in the prelude, we strongly disagree with the findings in the Section 59 report. It's been a protracted investigation over the last 5 years, and there's a few things that are really concerning for us out of the report. The first point to make and to highlight, and particularly to your views, is that Discovery Health has no way of racial profiling across our systems. We work on membership numbers and we work on provider numbers. We have no way of identifying race. We have no race tags across our system, so there's no way for us to racially profile across the system. Mm-hmm. The second point to make is...
Pardon me for interjecting there. And then this was indicated when you were, at least as medical aid schemes, when you were invited to make submissions, because in your statement, you've gone on to state that you also had a problem with the methodology that was used. So during that point where you're invited to make submissions as medical aid schemes, did you indicate that you have no way of knowing the race of the specific healthcare practitioner?
That's exactly right. In fact, during the course of the last 5 years, we've made 14 submissions to the investigating panel. We've included independent expert input into those panel discussions, including an expert from the London School of Economics, the previous statistician general of South Africa, and a range of other inputs. And the key point we've made is that we cannot, based on our databases and based on our tags, identify the race of practitioners. And that leads on to the point around the way the methodology was undertaken by the panel, we believe is deeply flawed and unscientific. So in order to infer race, what one needs to do is to convert names into a potential race picture. So you look at your particular name profiles and then infer based on those profiles what the race of the underlying individual and underlying provider is. It's prone to significant error, particularly across a small data set. And I think you would agree with me, across South Africa, we're a multicultural society with many races and many names, and there's lots of cross-pollination across names. So that adds has created significant concern around the methodology employed. Mm-hmm. And in fact, the
So just to get clarity, when it comes to the name, so it wouldn't be a practitioner's number that you would have. You would actually have the name, for instance, Mabalani. Then my surname at least would reflect there. Or it would be my practitioner number.
So we work on the basis of practitioner numbers. Associated with the practitioner number, we would have a name. Malung's a good example. Equally, we have names like Van Rooyen, and Van Rooyen cuts across the system. Pieterse cuts across the system. There are many other names that you'd have to then infer what the underlying race is. This is methodology we don't employ. We are entirely non-racial, across Discovery Health. We prefer to work on, practice numbers and membership numbers rather than names and surnames. I think it's also important to point out that through the independent reviews we've had across our fraud, waste, and abuse processes, none of the processes have pointed to any indication of racial profiling or bias across our systems. As I mentioned to you, we've had the London School of Economics involved in the analysis. We've had Deloitte involved in the analysis. We've had a range of local experts involved in the analysis, and there's no indication. It's also important to highlight, in all of the complaints submitted to the Section 59 panel by aggrieved doctors as part of this process, all of those complaints were proved to be legitimate complaints. They've all gone through a thorough and rigorous review process. We're proud of the processes we run and the rigor of our data analytics and of our systems and processes, and none of this has pointed to any indication of racial profiling or bias across our systems.
Now, what I'm gathering from you then is that this was all a coincidence. Because if we had to be granular, the report found that in 2017, black psychiatrists under discovery were about 3.5 times more likely to be investigated and found guilty of fraud. You're reducing this to coincidence. That yes, they were 3.5 times more likely to be found guilty, but it's either coincidence or demographics, that we have more black people in society, so generally you'd have more black practitioners. Is that it?
I'm not pointing to coincidence at all. I'm pointing to the statistical and analytical rigor of the investigation. I think the risk ratios that you point to are very important to highlight in this. So the report highlighted, as you've highlighted in this, that the risk ratio, the probability of a black practitioner being investigated as being higher than one of the other race groups, perhaps a white practitioner. But what's important to recognize out of that particular analysis is that the report highlights the instances where the risk ratio is greater than 1. For black practitioners over other practitioners. So in other words, 2 or 3 times higher. What the report doesn't report on is the instances where the risk ratio was lower than 1. In other words, where black practitioners were less likely to be investigated than white practitioners. And in fact, I can share with you across the analysis done by the Section 59 investigation, looking at 26 disciplines. 40% of the risk ratios were less than 1. Roughly 60% of the risk ratios were greater than 1. So I think you've got to look at both sides of the spectrum, and you've got to ensure that the analytical and statistical methodologies employed are actually generating the right insights of us. In statistics,
what do you intend to do now that it has been released? And as stated, it is quite damning. I mean, at this point, for the 3 medical aid schemes that have been mentioned in that specific report, it's quite concerning. So what do you intend to do?
Well, it's not only damning for the medical schemes involved in this particular matter, and it is extensive. It extends to the government employees medical scheme. It extends to PolMed. It extends to 16 other medical schemes administered by Med scheme, including Fed Health and Bonitas, and alongside the Discovery Health medical schemes and the 18 medical schemes. So it is a broad-reaching finding across the industry, and I think hence the interest and the seriousness with which you need to take this matter. I think it's absolutely critical that we enable the right processes in managing fraud, waste, abuse, and errors across the system. It's unreasonable to pay for services that are not rendered across the system, regardless of race, religion, ethnicity. So we need to maintain the integrity of the healthcare system. The integrity of the healthcare system ensures that providers are paid for actual services rendered, that we keep the affordability of the healthcare system in check, and I think we all recognise the challenges with medical inflation. So we're calling on the Council for Medical Schemes to consider carefully the actions takes on the back of this report. So bearing in mind that the report is not a legally binding report, it really provides recommendations for the Council for Medical Schemes, and we're confident that Council for Medical Schemes will consider the report in an appropriate manner to ensure that we protect the integrity of the system and the efficiency of the system to the benefit of your medical scheme members and indeed your medical schemes more broadly.
And of course, some of the recommendations there being an annual assessment of the impact of the fraud, waste and abuse system. But Doctor, thank you very much for your time this afternoon. That was Dr. Ron Whelan, he's CEO of Discovery Health.